I'm Lisa Ballard. I'm a health psychologist and a research fellow at the University of Southampton. I'm working on a project where we're analysing data from patients that are thinking about or deliberating a decision to have a test for Huntington's disease. So Huntington's disease is a disease that if you get, there's no real kind of cure or treatment. And if you're tested for the gene, so if you're found to have the alteration, you will get Huntington's basically. And so in the project, we were collecting data from consultations, from interviews, but also we were collecting data from reflective diaries. So participants were recording their thoughts between the three consultations they'd have. And myself, I was quite anxious through lockdown. I'm a sociable person. I work in a team of other researchers, a multidisciplinary team with like medical doctors, sociologists, psychologists, and all of that was kind of stripped away during lockdown for us all, really. So I was on my own, and so the anxieties of just the lockdown and the unsettling feelings, and it really did take me by surprise. And I'm thinking like this might be a way that we're going to be working for a long time. We're going to be working from home for a long time. And, you know, what if there's another pandemic? And these are the kind of, and what about if these are things that have been affecting researchers, but we haven't really been talking about them? And then I started looking at the literature, and it is something that people are talking about. So I came across a term called vicarious trauma. So it isn't something new, of course. People are doing research on really traumatic things. But I didn't know what was in the diaries. I hadn't collected that data myself. It was secondary data, and I guess I just hadn't put these things together. And the people I'm working on the project, we hadn't really anticipated that. I've seen health psychologists in particular rallying round and developing networks and using our skills. So all of the stuff around COVID is around kind of people's behaviour. And so as a health psychologist, I can feel proud that we've got a lot to offer that kind of particular aspect. And I guess more kind of personally and closer to home, I'm really glad that I was the person that flagged this issue up of like the kind of vicarious trauma of looking at secondary kind of data during lockdown, is that I'm the psychologist that, you know, it would have been horrible if it was someone else in my team and I was a psychologist and hadn't really kind of thought about it. So I think it's my responsibility, I guess. I think as a psychologist, you're trained to be very reflective. And yeah, I think also, I haven't really thought about this before, so I just started talking to you about it, but I have been trained to be reflective, and another person might not have felt confident to bring this up in their team. I mean, some people might not be comfortable saying that data I found disturbing, I couldn't look through it all. But I feel that that's important. I want to share it, and I'm able to. I've got the confidence in my team, I guess, to share it, because I know through my training the importance of keeping well at work and keeping well during kind of a pandemic.